Bacitracin is a great ointment to help incisions and wounds heal. Now, to be a good wound to treat with bacitracin, it needs to be a relatively clean wound and a superficial wound. If it is a deep wound with tunneling or undermining, bacitracin is not a good idea. You need to use 1/4% acetic acid gauze packing or a wound vac or something else. If it is a very superficial wound with no undermining and no tunneling and it has a tendency to dry out, bacitracin is a great choice because the bacitracin will both keep the wound moist as well as kill some of the bacteria that could be growing on the wound. Ointments with Neosporin are bad. Neosporin tends to create an allergic reaction in all people over time, which will make the incision and the wound look red and infected when in fact it is not. So I recommend using bacitracin only to treat superficial wounds that have a tendency to dry out. I should also mention that when you're using bacitracin to treat wounds, you should wash and scrub the wound gently at least twice a day, pat it dry, and then apply bacitracin. If you don't wash or clean the wound, it'll have a tendency to build up this white film called fibrin, which actually slows down wound healing. So every time you, or not every time you apply bacitracin, you can apply bacitracin like you would lip balm. Whenever it looks dry or needs it, put it on. But you should at least try to wash and scrub the wound 2 to 3 times a day to remove that fibrinous exudate that has a tendency to develop on superficial wounds. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.